Hello, I'm Dr. Joseph de la Seca. I'm a family doctor working in the Althea Foundation in Manresa, and I represent Wonka Europe.
I'm William Papaioannou, an EFP periodontist from Athens, Greece.
When I started working in this project, I realized that there is a link between oral health and family medicine. Some diseases may improve or worsen general health, and the opposite. Oral health may be affected by some pathologies, by some diseases. For example, the control of the diabetic patients may be impaired by the inflammation of the oral cavity. That's why I think that the cooperation between the two specialties is important.
Indeed, you have a point. As periodontists, we have to treat severe periodontitis, which is considered the sixth most common disease globally.
Really?
Indeed. And it is an important disease because, as you mentioned, it has significant correlations and connections with severe medical conditions. You already mentioned diabetes. There is a connection between periodontitis and cardiovascular disease, respiratory disease, pregnancy outcomes, and many other conditions can be affected by this inflammatory disease.
In addition, there are some shared risk factors such as tobacco, alcohol, obesity, lack of exercise, poor hygiene, and others.
I'm happy you bring up these risk factors because these are risk factors that are very important for us, and this is where we can increase the impact of our message by addressing from both of our specialities, from the side of the family doctor and from the side of the periodontist, the impact that these common risk factors have on oral health, but also on systemic health.
The periodontologists may play a significant role in the early detection and prevention, early detection of diseases and prevention of risk factors. That's why we should work together and share clinical information of our patients.
I agree completely with you. Indeed, as you say, but it's not only the periodontist. It is important for all oral health providers to take care of these common risk factors, properly screened from a medical professional as a family doctor.
The cooperation is important, and me as a doctor should refer my patient to the dentist more often. Sometimes I forget to examine the oral cavity. Since I'm working in this project, more often I take care of examining the oral cavity of my patients and refer my patients to the periodontologist.
Exactly, and this is the message that must come out from this joint project, that family doctor will refer to the dentist or the periodontist, but also the dentist or a health provider periodontist will refer their patients to the family doctor for proper screening when these problems arise. For comprehensive information, please visit the EFP website on the project Perio and Family Doctors.
You can also find the information on the website of Wonka Europe.
Thank you very much for helping in this significant endeavor.
It's been a pleasure and the start of a good cooperation.